Because they started at different times in development, they're in different stages of clinical development and introduction to therapy. The one which is the closest to frontline therapy is combination of lenalidomide and rituximab, or R squared. This combination has been compared in randomized study against chemoimmunotherapy. And the study has been completed and the results of the studies are now maturing. So it'll be a very interesting study to watch. Another interesting studies which has been done in this induction therapy like sphere had been with maintenance rituximab. We highlight some of those which show the benefit of maintenance rituximab in this setting, post-induction treatment in elderly patients, but also after high-dose chemotherapy and autologous stem cell transplantation in younger and fit patients. In terms of the other targeted agents, they appeared a little bit later in development, so they are now being tested in the relapse and refractory setting and slowly moving to upfront setting. Ibrutinib has a very significant single-agent activity in mantle cell lymphoma. It can be also combined with rituximab, which further increases its activity. And now addition of ibrutinib is studied with bendamustine rituximab backbone against bendamustine rituximab alone, again in ongoing phase 3 study. So that's another example of the agent which moves from the relapse refractory setting to upfront. And this study is very interesting. We'll be watching it very closely as well. Venetoclax just recently was shown to have very significant single-agent activity in mantle cell lymphoma. There are some combination studies already being developed. I'm not aware of any frontline studies yet, but I'm sure that frontline combinations will appear. What would be really interesting, though, is to see combinations of targeted agents like venetoclax or ibrutinib together, and basically getting rid of the chemotherapy backbone, particularly for older patients, which we do not treat with intensive combination chemotherapy and autologous stem cell transplantation. In those patients, this approach would be very interesting.